This is Bernie, the respiratory therapist at West Coast General. Today we are going to learn how to put a heated humidified circuit on a clean ventilator after you have used it. So we've just finished cleaning it and we're going to get ready to recircuit it. First, we're going to go to the back respiratory room in the ICU respiratory supplies room, and we're going to get the bag of circuitry that we have decided would be best in this hospital. This bag contains the whole circuit set up, just ready as a plug and play, and away you go. So everything you need to refit the trauma room is in this bag. And ultimately, your ventilator will look like that. This is always a reference device to know where everything will go on the ventilator. It has it all laid out with little wording here, there, and everywhere. So you can always refer back to this. Let's go and build our ventilator. Being that this is probably going to be going back into the trauma room, this bag contains a bagger that is all set up with a PEEP valve, an expiratory valve, the bag mask, and in here will be 2 OPAs, size 8 and size 9. Also in here is something for the back of the ventilator, and that is your inline suction catheter already hooked up with your end tidal in the right place. So once your patient is intubated, place the inline suction on, and this will probably already be on your bagger. You're just going to take it out of place of your bagger, put it back in, and run off your end tidal. And we will put it in the back of the ventilator, ready for use. The main piece right here, as you can see, is all set up and ready to go. Plug and play, easiest done. It will always be stocked up. There will always be at least double the amount of ventilators that we have in set up circuits. I'm just going to put those down for now. First thing you're going to want to do is slide in your humidifier. Oh, there we go. That's why it was hard to get in. So once your humidifier is slid in, and you want to make sure it clicks in, then you've got your blue limb and your white limb. Your blue limb is your inspiratory limb, and your white limb is your expiratory limb. And so we're just going to follow this back. On the ventilator, we have inhalation, the little man with an arrow going in, so inhalation, and a little man blowing out, exhalation. They won't be hard to distinguish, but best by just what's going on them. So you press in your first inspiratory limb, which goes into the humidifier and then comes out of the humidifier into the next blue limb and goes to your patient. Your expiratory limb here, the white one, has its expiratory valve on it. You're going to take off the protective hood, and this part you're going to have to just disconnect for a bit so that you can actually slide it in the exhalation valve slot. It won't be in until you feel it click. It's actually quite a hard push. Then the rest of this can then fit on. So now you have your inspiratory limb and your expiratory limb connected. And it's looking more like what you would use on a patient. The last things that need to be plugged in is your flow sensor. Your flow sensor sits proximal to the patient here, and these two ends, the blue and white, will then hook into the ventilator. Blue on blue and white to white. Once you've got it in and it's secure, you are done there. Last things that you need to connect is the humidifier. You have a blue plug, and there is a blue plug here. We're just going to slip that in. This is the module that makes the heated humidifier work. It stays with the unit when you're cleaning it. The only one that goes to MDR is the actual humidifier probe that is inserted into the inspiratory limb. You have on the other end of this a 2-prong and a 3-prong connection that will then go into the inspiratory and expiratory limbs. The 3-prong will go into the inspiratory limb right here. Line it up and push it in and slide it into the expiratory limb. Both should fit in fairly easily and snug. Now your ventilator is all set up. Last thing in here, well, one of the last things is the water bag. You want to hang that up ready. This never gets spiked until your patient is on the ventilator. And it gets spiked with the humidifier spike, which is going to stay secure and clean right here. That is an area that can be a source of leak too. Once you've got everything set up, wind up your cords. Your oxygen one can just sit in the back. Your ventilator needs to be plugged in, so leave some slack. It will be plugged in so that the battery stays charged, and that is setting up your ventilator. Last thing we're going to do prior to putting this away and signing and dating it and bagging it ready for use is we're going to do a pre-op check. Once the screen comes up, you will see the front screen. You will see pre-op check. You're going to hit the pre-op check and you'll see all 3 tests that can be done. We do 2, and I'll talk about the 3rd one after. So to proceed, you're going to hit on the test and it is going to tell you what to do. So it's saying disconnect the patient. We are going to take the blue piece off and just put it up, and it's saying block the circuit. This is why I keep the blue piece on here, so we can keep the circuit clean. The picture will show you, guide you throughout everything that you need to know about the ventilator. So we're going to reconnect. In this case, just open up the circuit again. So if you get a green check mark, a date and a time, you have successfully passed your leak test. Going on to the flow sensor test, we hit that. It says to disconnect the patient, which we have. We're going to use the little device here, place it in the flow sensor and flip it. Calibration will be in progress. And your next message, when that's done, will come up on the screen. Okay, so here's the screen. You're going to flip it again and take the device out and hook it here. Then it will continue on with the calibration. All right, and you've got a green check mark, so the flow sensor is checked and ready for use. The last thing is the oxygen sensor. We don't really have to do that one on a regular basis because the oxygen sensor gets checked every time you use this ventilator. If there's a problem, you will get an error code. That is essentially how you set up. The last things you're going to do is, in the bag, there is a bag to cover the ventilator, and I'm going to grab a piece of green tape where we're going to mark it that it's cleaned, checked, and ready to use. And you're going to put the date on it, that it matches this one here, 20th of September 23, and the time that you did the check, so 7:38 a.m. And then just put your name to it. The last thing you do is take the bag that's included in the kit, and we're just going to push everything together and cover it up so that the device stays clean and ready to use. We're going to store it. I'm going to turn off the screen and store it in one of the areas that we store it right now, which is either in the back room with the respiratory equipment or in the ante room. Make sure that it is plugged in so when you utilize this, it has enough battery power. And you're done.